Dr. Cole Stanley, who many of you know by now. He is the medical consultant for Boost and has been for a few years now. He also works as a family physician at the Hope to Health Research and Innovation Clinic, and he's the innovation and QI lead there as well. Welcome, Cole, and I will turn it over to you if you're ready.
I'm ready. Thanks so much. Good morning, everyone. So yeah, silver lining with Jenny not being here is we will get more time for you guys to work as teams on your aims if you haven't finished that, and then getting to change ideas. In previous iterations of the collaborative, we've always found that people need more time on this anyway. So silver lining. I'm going to drop a link in the chat, and it's for a Mural board that I'm going to try using for this session and for you guys to use when you work as teams. So it'll take me a bit of explaining. First of all, the password is interior boost, all one word. So I put that in the chat too. If you could go in and try opening that up, but if you can't get it yet, that's no problem. I'm going to share my screen to show you what it looks like. So because we can't really meet in person and have a big kind of wall of different storyboards and papers, I thought I'd try this out to make it feel just a bit more like we're working on something together. Also, I like trying out these new virtual tools just to see how it goes. So had a bit of extra time on a slow clinic day yesterday, so I really nerded out on this, and hopefully it's useful for us. Okay, so I'm going to, so you'll see, maybe you noticed that you can actually see your different presentations, hopefully located around where your sites are. And then beside them, you'll see boards that you'll be able to interact with the board. Just as you can see me doing here. I'll explain that in more detail later. But basically, when it comes time to work as teams, you'll be able to have somebody in your breakout room control this, share their screen, open up your board, and then record right on there. And then we can move around and see how people are doing and help people out. And hopefully have one large representation of our work today once we're all done. But before that, let me go through some basics here. So I'm down in Vancouver here. So you see I'm gonna go start down over here. I'm just getting you guys right on the screen here. So most people have really developed their aims. You may still need to be getting some final touches on the aim to make it a smart aim. So we can certainly help you with that if you still have questions around that today. Remember, the aim is the what are we trying to accomplish. Next, we're going to, and so your aim probably should have one of your outcome measures in it as well. Today, we're going to move on to change ideas. And I know a few of the teams have already started testing some change ideas. When I talk about change ideas, it's that long list of things that we can potentially do differently in order to get our better outcomes, and appointment text reminders being a prime example we've heard of multiple times already today. So we'll spend some time on that. So remember, with your aim, maybe a good first check when you get with your team today would be to say, is our aim really the primary thing we want to be working on? And is it a smart aim, right? Do we have a specific time frame? By how much? Don Berwick, kind of the most famous QI physician, would say some is not a number, soon is not a time. So make it specific, measurable, attainable, be realistic, but you can set it to optimistic but realistic, let's say that. Make it relevant to the core function of what your team is doing. And yes, time-based, kind of an extension of specific there. All right, so does anybody know what this is? Can somebody yell out what this is?
isn't this the IH boost aims and kind of action plan?
Yeah, so at the top, you've got our overall collaborative aim, right? So you've got the text and then the 3 bullet points of our overall collaborative measures. So active OAT scripts, 95% of those with an active prescription retained for greater than 3 months. And we want to have all the teams incorporating the patient voice. This tool we're looking at, this diagram, is called a driver diagram. Okay, so this is what is really a visual aid to help us get from our aims to our change ideas. And so we had multiple iterations of coming up with this all the way back in 2017 when we started Vancouver Boost, coming up with these categories. So what you should be able to do is go from the aim to the primary drivers, which is education, OAT treatment, all this, to secondary drivers. And then from the secondary driver, you'd be able to continue drawing lines and start putting your change ideas, right? So let's take the appointment reminders, for example, and see where that might fit. Anybody want to try that out? Like, where would you put the change idea of appointment reminders on the driver diagram? You can put up your hand or just yell it out.
Medical care?
Yeah, I think medical care, it seems it would be probably in follow-up. Yeah, but certainly there. So if you had if you had this driver diagram up, you might draw another line off of the follow-up and put appointment reminders. And that's going from change idea to drivers to your aim. Okay, so whenever you're getting stuck on what else can we try, it'd be good to orient yourself and say, this is overall really what we're trying to do as a collaborative. And then we can work in all of these spaces, right? This is a big, hairy, complex problem. It's not just going to be 1 or 2 things that solves this for us. We're going to have to work in these different areas, make a bunch of changes to really see breakthrough improvement in our outcomes. All right. So luckily, we provide you with this change package, okay? So this is part of the resources available to you. It's a short, concise document of a list of changes that you can think of testing. You don't have to be completely limited to what's in the change package, but certainly it's a good place to start. See what's in there, see what maybe you're already doing, but could be doing more of. You don't have to limit yourself to that, though. We want you to be creative as well and test out new ways of doing work to get better results. So I think it was Kelsey, we wanted to talk a bit about, okay, maybe you have too many ideas and you're thinking about where should I actually start? Well, this is where this idea of a pick chart can come in handy. You can do this also virtually if you have a virtual team, or do it in a room on a big whiteboard. But basically, you make it a 2x2 here where you put difficulty along the bottom. So how hard would it be to implement this change or do this change? And then what's the potential payoff, right? So you would take each of your change ideas, like, for example, appointment text reminders, and you'd say, maybe that's about medium to difficulty to put in. That is going to take, some time for a staff member to do each day. We're going to have to get that set up. Maybe that's medium, but we think maybe it's a high payoff, right? Because if most people are able to get texts and that really helps people get into their appointments, that's potentially a high payoff. So then when you have all your ideas laid out on the pick chart here, you could probably for your first ones say, what are the quick wins? Or actually, you're going to start here, obviously take the easy ones with the high payoff, quick wins, things like that, and then maybe move into ones that are more challenging. All right, so once you've chosen a change idea, that's when this PDSA cycle comes in, right? And so it starts with a plan on a very small scale. How am I going to take that idea and test it out? It's not that we're going from idea to implementing and right away and saying, this is how we do things now. In quality improvement, we want to test things on a small scale first to see if they work and to actually learn how we can adapt our idea and make it better, usually through multiple iterations, different conditions, a different scale before we implement it, right? So we're not just saying tomorrow our peer shall do appointment text reminders forevermore, the end of story. Usually changes like that do not work, right? So a much better way to implement a change like that is to first test it out. So your plan for the appointment text reminder might be, for our session tomorrow, just once, we're going to try having our peer do text reminders before and see how it goes, see what we learn. Okay, so that's your first PDSA cycle. What makes a perfect PDSA cycle? So if you wanted top marks for your PDSAs, here's the checklist. And so this thing on the bottom right here, this checklist comes from a paper where they were looking at a bunch of teams in the UK who were used to doing regular QI. And they were saying, from what they could see, how many of the teams were adhering to this checklist. And they saw that only 2% had adhered with all 6 measures. So 2% of all the PDSA cycles done actually hit on all these. So it's kind of like dancing. Everybody says they can dance, but dancing to this level is really hard to do. So don't worry if you're not getting it perfect from the get-go, but a good thing to do anytime you have your PDSA plan is to say, am I considering all of these, right? Am I, for example, not writing down the study section until after we've done the test? Am I making sure we're actually planning this as a learning activity? So including some questions like, how will the peer feel about doing the appointment text reminders? How many texts will not go through? Questions like that make it a learning activity. The other key piece that's probably the most often missed is you pair that question or that set of questions with a prediction. So how will the peer feel? I predict they'll enjoy doing this and connecting with clients and will feel that this is a useful part of their workday. I make that prediction because I know how much our peer loves that, but it may be a different prediction for you. Iterative cycles. So this is where at the end of your first small PDSA, you're going to say, how did that go? How can we either adapt to this and do another PDSA, adopt it, say we're done testing, we want to adopt and implement, or abandon. It was a disaster. There's no fixing this. Let's move to a different idea. Small scale testing I've mentioned. And then you want to keep looking at your data over time. Your first small scale PDSA cycles will definitely not change your overall outcome measure, but that's why we use that driver diagram, which is our theory of change, where if we change things all over that driver diagram, we're hoping that eventually our overall outcome measures will shift. All right, so now that we've got that, were people able to open the Mural board? I'm just going to try and see you guys here. Let's see. So give me a sec here. Can you just give me a thumbs up if you were able to open the Mural board? You can use your reaction like I'm doing here, clapping or whatever you want to do. If you really love the Mural board, you can give a heart. Anybody having troubles opening it up?
I could open it, but I couldn't see all the slides that you had.
Okay. So yeah, so if you go to the link, enter the password, you should be able to open it up. It's a bit tricky sometimes if you're on like an iPad or an iPhone, but if you're on a computer, it should be okay. Don't worry if it's not. Somebody in your group will be able to navigate it for you. But let's go back and I'll show you some of the basics here. So navigating around, if you have a mouse, you can right click and drag the board around, okay? So that's one key movement in it. Another one is on your mouse, if you have a mouse wheel, you can zoom in and zoom out as you would use the mouse wheel for usually. If you don't have that mouse wheel, you can use these in the bottom right. So you see I can zoom way out and then right click and drag and move over here. So you see that on the bottom right. You can also, if you have a touchpad, you can do it kind of like, you know, on your smartphone. If you're zooming in on a photo, you can pinch and expand or contract there. So that's moving around, and then let's go. So I'm pinching with my touchpad here. So the next thing first of all, I did put a link you can click on if you want to open our website and find the change package and that. So you could click on that link. I'm right here. Now, the other piece that we'll have you do is hopefully add your aim statement and then an initial PDSA plan for your team. Okay, so let's say I was the Vernon team. I'm going to find Vernon, which is hopefully easier for you guys than for me. And there they are. Okay, so I'm going to zoom in. I added all of the storyboard presentations. So if you wanted to see other people's presentations there after, you can go back to that. But basically what you'd want to do is find your team, really zoom in close to your board. And this is where your team's going to be working during the day. And then the only thing on the board that isn't locked down are these sticky notes, right? So you should be able to, now it's because I'm in presentation mode, but if you're not in presentation mode, you can click on the sticky and you can edit. Okay, you can also move it around. You can right click and get really particular about the style of the sticky if you want, the colors. You can duplicate it if you need more stickies. You can also go to the left here and add other sticky notes if you want. All right, so I'm going to delete that. So it's good we have a bit of time to get used to the platform as well. But I'm going to go back down to the example I have here. Well, let's see what else I have here. So one more slide here, questions. I'll just show you the example I put. So let's say my team, my imaginary team's aim was to increase our 3-month retention from 50% to 95% by December 2022 for our clients on OAT. One change idea we may want to test, I've put it down here and put an initial PDSA plan. Okay, so who, what, where, when. This is, you know, what is the actual thing you're going to test? Maybe it's the LPN is doing follow-up phone calls. And I gave it away earlier that phone calls really did not work for us, but maybe that's something we wanted to test. Because it's a small initial PDSA, we're not doing it for the whole clinic's clients. We're just going to try it first off, maybe one MRP, one session, see how it goes, see what we learn, then decide, do we continue with this? How do we adapt it? Maybe it's just one session, maybe it's over the week. Depends really on what you think is enough time or volume to really learn something, but not take up too much resources. And then when is it going to happen? So maybe they're going to do it during admin time at the end of the day. That's another thing where I'd say, oh, that's usually much harder than at the start of the day. So that's the who, what, where, when. Okay, you've got some sticky notes for that you can fill in. The next part of a PDSA really should be, what questions are you trying to answer? So if you're stuck there, you can think back and say, okay, what am I doing? And then what questions can I ask about what I'm doing? So maybe it would be, how does the LPN feel about doing this? How does it, their qualitative feedback of how this is going. Maybe it's, how long will this take the LPN each day? Maybe what percentage of the phone calls will go through? What percentage of the days will the LPN be able to complete it? You can think of a long list of questions. You don't need to think of every question. What are the most important questions here that you're wanting an answer for, though? So put the questions here, and then try to pair it with a prediction. There's no penalty for being wrong. It's just an educated guess based on the information you have. By putting the prediction down before you present, you prevent hindsight bias, okay? Which is, after the fact, we're, as humans, we're prone to saying, oh, of course it went like that. I knew that would happen. Actually, a lot of the time we don't. So put a prediction down. And then it's easy. Once you do the test, you compare your results to predictions. That's where you get the learning, okay? And then you want to collect some data usually, and that's in order to answer your questions. So maybe it's the number of calls here, who's going to track it, the LPN doing the work in this case, qualitative info, that can all fit there. So that's an example of a PDSA plan. Now let's move back over here. I'm very zoomed in, so I'm going to pinch and zoom out a bit and just ask, are there any questions? And let me try to open the chat here. Share the Mural link. Okay, looks like you got that. Kelsey, did you want to add anything?
No, I don't think so. That the only question I would have is that, so this is going to be done for one PDSA at a time, and then would teams, if they were to use this, just edit the information for the next one they were trying, or add a different one altogether?
I'd say start with one, and then if you're needing more, what I can do is probably the easiest would be to just go in and duplicate and kind of put it below like that, I think. But start with one, and then if you're getting to needing more stickies, you can just select all of them, right click and duplicate, then move them around, and you've got another board.
Great.
Does that work?
Yeah, I think that's great. Thank you.
Okay, so why don't we try to get into our breakout rooms sorted by team. And then the first challenge is getting somebody in your group to share their screen with the Mural board and to zoom in on your team's board and be able to kind of quarterback the editing of the sticky notes. Okay, and I know probably some of you are thinking, thankfully we have the extra time to figure this out. But if we get it right this time, we can keep using this tool for our next learning sessions as well.